Welcome everyone to Healthcare for All Minnesota's quarterly meeting. We are so happy that you can join us today. Just a few housekeeping items. Number one, if you have technical issues, please put those into the chat. If you have questions that you would like answered by any of our panelists today, please put those in the section labeled Q&A. my name is Judy Barton and I'm with Healthcare for All Minnesota, and I am going to go ahead and hand this on over to Ann Jones. Ann?
Thank you, Judy. Good morning, everyone. I am Ann Jones, a retired registered nurse and Vice Chair of Healthcare for All Minnesota. I'm going to be moderating this morning and trying to keep us on schedule. I want to say, in the context of the truly distressing events in Eastern Europe right now and other places around the world, I thank you for choosing to spend some time this morning with us to talk about health justice for all. These are our presenters today, and our agenda includes a welcome and remarks from our board chair, Dr. Mark Brockie. Maggie Emery, our new board member, will be introducing herself this morning. Then we'll go to a treasurer's report by Don Pilkinen. And then Carol Engelhardt will come on and talk about a fundraising event we've got coming up in May. Our keynote speaker this morning is Kevin Brown, small business owner, and he will give us the perspective from the point of view of a small business owner on the cost of healthcare in Minnesota, in this country. And we will have a few minutes for question and answer. Our next up will be Don Pilkinen talking about the City Council Resolution Initiative. And then Ken Engelhardt, Dr. Engelhardt, will talk about lessons learned from the California experience recently attempted to introduce a single payer bill in California. I'll finish up with some information from the Education and Outreach Committee and announcements, and then we'll have a wrap up. That's our morning, and let me invite Dr. Brockie, our board chair, for a welcome and some remarks this morning.
Good morning. It's nice to see you all here this morning. And I hope nobody went out their front door and took a slide, because I discovered there was some ice on my front steps. And so this is actually not a bad morning to be inside doing a Zoom call rather than sliding around outside. We're delighted to have you all here. I wanted to talk about something that I haven't seen addressed much in the past, and that is the issue of how much does our current healthcare system cost us personally? You may have found yourself talking to someone who is lucky enough to be healthy and has not had to experience inadequate health insurance, including high deductibles, out-of-network charges, and frequent expensive copays. The immorality of the current U.S. healthcare mess may not move that person to action. What might motivate them? Perhaps looking at healthcare through the economic lens as it affects them, their children, and their children's children. So let's just take a quick look at this. It turns out that per capita spending in the United States is about $10,948 per person per year. And the next most expensive country in the world is Switzerland at a little over $7,000 per capita per year. And of the modern countries, New Zealand is actually the best with per capita costs of only $4,200 per year. And I would point out that both Switzerland and New Zealand have better life expectancies than the United States has. There's a concept in accounting known as opportunity cost. Opportunity cost means the value of an opportunity over a period of time. So let's imagine that all Americans had the opportunity to save the amount of money that separates us from the next most expensive country in the world, Switzerland. That's about $3,810 per year. If one takes that money, if one were to take that money and invest it for 65 years as a way of saving for retirement at a very conservative rate of return of 6% per year, the number that comes out is actually quite astounding. It turns out that the difference between the cost of U.S. healthcare and Swiss healthcare is costing us over $2,900,000 per person over 65 years. I think that number is quite outrageous. So you might keep that in mind when you're talking with your friends and neighbors about the need for healthcare finance reform, because U.S. healthcare is costing each one of us a huge amount of money at the present time. Moving along, I'm happy to report that there are a lot of positive things occurring in the realm of healthcare finance reform in Minnesota. You will be hearing about most of them from subsequent speakers this morning, and you can stay up to date from week to week by reading our monthly newsletter, by following our webpage, and following our social media. One additional item, in addition to the valuable education that I know you do with your friends and neighbors and the organizations you belong to, I have one further ask of you. Please give us your financial support. We cannot grow and become more effective without adequate funds. Our Secretary Treasurer and our Chief Fundraiser are both going to be talking to you a little bit more about this morning. We appreciate what you do to help make us effective. So with that's enough for my introductory remarks. I'm going to now turn the screen over to our newest board member, Maggie Emery.
Thank you, Mark. Hi, everyone. I'm really pleased to be here today and to have a chance to introduce myself to all of you. My name is Maggie. I just joined the HCA-MN board about 2 months ago. So this is my first quarterly member meeting. In my professional work, I am the Director of Development and Communications at Protect Minnesota, which is a gun violence prevention nonprofit here in Minnesota. And I also run a small consulting firm that helps Democrats in rural areas with messaging, fundraising, and strategy. So I hope to kind of take some of those skills and apply them to my work here with HCA-MN. Healthcare is a deeply personal issue for me, as it is for so many. I have an essential tremor that is severe but managed in my hands and my legs, and I turned 26 last year, and I had to go through the whole process of trying to figure out how am I going to continue to get the care that I need to manage my condition so that I can live my life in a normal way, so I can do the things that I take for granted, write, type on my computer, drink a cup of coffee, all that kind of stuff that if I wasn't able to get access to my treatment, my condition would prevent me from being able to do on a regular basis. I also believe that chronic condition or no chronic condition, by virtue of having a body and inhabiting it, we all have a right to have it taken care of. So that's about all I got. I'm really pleased to be here, and I hope to have a chance to meet more of you as my tenure with HCA-MN continues. Thanks, Mark.
Thanks a lot, Maggie. Appreciate all of your contributions so far. I'm going to next call on Don Pilkinen, our Secretary Treasurer and Board Member of Healthcare for All Minnesota, for a Treasurer's report. So please go ahead, Don.
Yeah, thanks, Ann. And thanks, Mark, for enlightening us earlier about how single payer could have benefit our own personal wealth over all these years. So I'm going to start talking to folks about that. And Maggie, it's really great to have you on the board with us. And it's been a pleasure working with you on some of the finance stuff. Now on with my report for the quarter. After keeping up with expenses for our expanded activities in 2021, for which we thank you, we're looking ahead much more activities in 2022, which will need your support. 2022 started with the launch of the Legislative Caucus for the Minnesota Health Plan, which will be leaning on HCAM for help. Caucus leaders told us February 10th that legislators will need to see local support for the Minnesota Health Plan in their districts in order to support legislation at the Capitol. Therefore, our job as a grassroots citizens organization is to help the caucus with turnout for their planned statewide barnstorming events, such as town hall meetings. Furthermore, HCAM will be doing increased education and outreach on the health plan at Pride Fest for the third time, Farm Fest for the first time, and community activities. Also, coalition building is expanding to more organizations, which are now up to around 20. All this is requiring more work hours for our social media specialist, Carolyn Hankey, who is increasing traffic on Facebook and our other social media platforms. Increased fees for Every Action and Zoom for more meetings and webinars. Greater visibility at our events with handouts, signs, t-shirts, banners, buttons, plus fees for registering at these events. And paying our administrator, Julie Barton, for her excellent work in coordinating these activities with several committees. So thanks to Carol Engelhardt and to the volunteers who are organizing our next fundraising event in May to help pay these expenses, and to board members who generously donate at least once a year. And for those who haven't tried it, see how easy it is to make online tax-deductible donations to our 501c3 HCAM Education Foundation. Just click the donation button on the upper right corner of our website's homepage that connects you to the contribution page. If you prefer donating by check, you can get a tax deduction by writing your check to the HCAM Education Foundation. Thank you for your support in 2021 and for the work that lies ahead in 2022. Thank you to those who have chosen to make a donation of any size. Everything helps. Thanks again.
Thanks, Don. All right. And I want to introduce Carol Engelhardt again. Many of you know Carol, and she's been extremely busy working on an upcoming fundraiser event she's going to talk to you about. And I'm going to take down my slides so Carol can put hers up.
Good morning. I hope you can all see me here, and I am going to share the invitation for the May 20th fundraiser. On the agenda, it said May 21st. It's going to be a lot of fun. We have food trucks. We're going to do it at Waban Park. We're going to have a Canadian nurse and doctor speak. So let me share the invitation that was so nicely made here. Okay, everybody see it? All right. So we want to invite you May 20th, 2022 at 5:30 p.m. And we are going to sell raffle tickets for raffle baskets. We're going to have silent auction items. And it is a draw to invite people that might be curious about I really want single payer, but I just don't know what it would be like, because we're going to have our very own Rose Roach, Executive Director of M&A and a great moderator, and on our board, interview a Canadian nurse and doctor live. We have Greg Blair, who's really good at technology, that's going to help us with the hotspot. Let me see, there we go. We don't want that extra stuff down there. So when I scroll down my screen, you can see we're charging $25 for adult ticket and $10 for kids 12 and under. And we're going to have food trucks that are great, mocktails, raffle, silent bidding. One of the things we're going to do, and I need your help with it, I'm going to ask you if you can volunteer that day to be a host, a mingler, help with registration, help with the raffle basket area. We do have someone doing children's games, but I'm sure she could use an assistant. If you could do that, and the chat is my email that Jen is putting in, which is carolengelhardt@gmail.com. The other thing we could use help with is if you'd be willing to put together a basket like of fun coffee and mugs of coffee from a local coffee shop, maybe some spa items like hand cream or different things that people might want to bid on, 2 people having coffee, a wine and cheese basket. We are going to get some baskets from businesses, but we're being very sensitive to the fact that right now with the pandemic, we have to be careful what we're asking about. So we're also going to be doing some of our own things. And one of the things we're going to do is we're going to have a birthday party as a silent auction item with a live pony ride that people can bid on. The other thing is an executive chef meal. So with that, I am asking today that we're going to be like Minnesota Public Television. And right now in the chat, and then I'm going to have, you can go to our very own Every Action registration. And then if Judy would share the page now, we'll take down the invitation of Every Action to get there from our website. So I'm going to stop sharing. And Judy, could you put that up?
Hi, everyone.
Go ahead.
Oh, hi, everyone. So this is the Healthcare for All Minnesota webpage. And right here, you'll see something that says 2022 Spring Fundraiser. If you click right here on this button, it will direct you to the page where you can get the information about the event and where it's being held. And you can input any of this information. And then down here, you can select your tickets that you want to purchase. So if you want to purchase 2 adult tickets, you can select any quantity you want. If you want to make an adult ticket plus a $50 donation, you can do that here. Child tickets, again, child is for ages 12 and under. You can also, we have our Health Justice Allies, which is one of the programs that Healthcare for All is most proud of at the moment. And this will have Kevin Brown speak, who's a member of the Health Justice Allies. If you would like to donate a ticket to one of our Health Justice Allies so that they can also attend the event, we would greatly appreciate it. Business sponsorship, if you have a small business that you would like to sponsor, the business sponsorship, and as you can see up here, it's noted, will include 2 adult tickets, a shout out on social media, logo on event signage, and verbal recognition at events. And then you can also do additional donation to Healthcare for All Minnesota. You can simply select here, or you can put in whatever amount you want to right here under additional contribution.
Thank you, Judy. So what I have is a challenge. You know, before a fundraiser actually happens, we need you to invite people, but we also need you to donate today. We had to pay a park fee to get the site rented. We want to be able to make this successful. And the $25 pays for your food voucher and some of the other extra expenses that are involved. But I would like to see, can we make $1,000 today, this morning? Can we get people to give $50, buy a ticket plus 50? If everybody gives a little bit, we can sponsor those 2 silent auction items I talked about, executive chef meal or the pony party for a child's birthday. The one things you don't have to sponsor that you can bid on at the silent auction, there will be a week at a Florida condo. I believe it's called Santa Maria Island. It's Ann Jones condo. She can correct me if I'm wrong on that.
Anna Maria Island on the beautiful Gulf Coast.
Anna Maria Island, it's just beautiful.
Yeah.
Our cabin on Lower Clam Lake, which for a week in the summer, we work it out, where it's a warm water lake, a beautiful place to swim and bike and take your kids or adults. Also a loft place that is right off the Berkey Trail, where you can bike and ski or hike and just be right in the cable area. One of our good friends owns a resort up there, and she said she would donate the loft for a few days. And a sailing trip on Bide-Makaska guided by our own Mark Brocky. So those are some of the fun, larger silent auction items. But today, I know I'm going to, when I get off this, and Judy's going to share what we made. I'm asking that all of you go and even give some. 10, 25, 50, whatever we can do today to start this fundraiser now, because you know what? We are an army of people and we can do this. We may not have millions of dollars. We aren't United Health Group that's in our own yard, not just our backyard. But it's going to take some money to make this happen. All the things that Don shared, we need to make this happen. We here, the citizens of Minnesota, to have Minnesota Health Cram come from a dream to reality. So I'm asking you to help today, and that will really make all of us very happy this morning to make a difference. So that's my pitch, and this is how you register. And we really hope that many can donate today and invite your friends. This is something like, okay, I know some things about gun violence and I support it whenever I can. I vote the right way, I sign a petition, but I'm not a core activist like I am for Healthcare for All Minnesota. But if they had an event that I could go to and give money to, but also have fun, go to a good speaker, I would go. So this is what we're doing. We're giving people the information that, hey, it works in Canada. All those lies you heard, they aren't true. So thank you for your time, and please give this morning so that we can carry on this good work. Thank you.
Thanks so much, Carol. As you can tell, there's a lot of heart and work in going into this event. We're looking forward to getting together for the first time in 2 years, I believe. Come on out and invite your friends as well. So next, I am very pleased to introduce to you Kevin Brown, small business owner in Minneapolis. Kevin, I believe it's 35 years just celebrated. You want to come on? Thanks. And an advocate for policy positions to help business owners, including paid family leave and fixing how we pay for healthcare. He's involved with both Main Street Alliance and Metro IBA, Independent Business Association. Kevin was one of several speakers on the Capitol steps in minus 10 below weather on January 26th. And we all felt like he really has information that we all need to know, and we all need to get out there. We have to have this in our toolkit for when we're advocating for healthcare payment reform. This perspective from a small business owner is extremely important. So please listen carefully for some key concepts that you can use when talking with about this with others, people we need to bring along to make this happen. And we did build in time for some questions. It looks like we're actually doing well on time this morning, and we'll take as many as we can. I want to turn this over to Kevin. Thanks again.
Thank you, Ann, and thank you to the dedicated volunteers of Healthcare for All Minnesota for the opportunity to speak about the challenges small business owners face in trying to provide healthcare benefits for their employees. I'm the owner of SmartSet Incorporated, a 35-year-old graphic design and printing company in Northeast Minneapolis with 5 employees. We're a certified B Corporation, a union shop, and members of Main Street Alliance and Metro IBA. For over 3 decades, we've provided health insurance for our employees, not because we had to, but because it's the right thing to do. In addition, healthcare benefits are vital to attracting and retaining the best employees. We pay over $35,000 a year for healthcare coverage for our small group of 5. That works out to $5 for every employee hour worked. Think about that. There's also a deductible of $4,600 per person, and this is a good silver plan. To cover that deductible, an employee would have to save more than $2 an hour for every hour that they work just to be able to access their insurance. Most people's insurance isn't going to pay for anything unless you have a catastrophic health event. Paying $7 for every hour worked for healthcare insurance is unsustainable and very bad for business. Small businesses account for half the jobs in the state of Minnesota, but we pay on average 18% more for healthcare compared to large businesses, and even more compared to the largest corporations who can self-fund their coverage and pay benefit managers to control costs. Why are we seeing the Chamber of Commerce and big corporations fight universal health coverage? Is it because they know that small businesses are paying more than their fair share in a system rigged to benefit the largest employers? Leveling the playing field is vital to growing our local economy, since according to the SBA, companies with less than 20 employees create the most new jobs in Minnesota. A level playing field would be good for business in our state because it would benefit the most job creators, small businesses. A 2018 poll conducted before the pandemic by the Small Business Roundtable found a full 31% of respondents marked healthcare as their #1 concern if there was only one issue for Congress to deal with. In another survey of 827 small business owners conducted 1 year ago, most small businesses named the cost of providing health insurance to their employees as the biggest challenge they face, 55%, topping those who named COVID-19 as the biggest challenge, 37%. We don't seem to hear about that in the media much. Half of small business owners in the survey reported providing health insurance as a benefit, and 76% of small business owners who do not provide coverage say it's because the cost is too high. 53% of small business owners who do offer insurance have considered dropping it because of rising costs. 9 in 10 survey respondents said their health insurance costs increased over the past 4 years, with 40% responding that costs have risen by 10% or more a year. And 92% said health insurance carriers are very or somewhat responsible for the rising cost of healthcare. I spend 20 to 30 hours every year researching options, comparing private plans to the exchange, talking to employees about their needs while trying not to invade their privacy. I'm certainly no expert on health insurance, and I never will be. Why are small business owners expected to bear this burden? This is not good for business. A September 2019 survey by the Commonwealth Fund, again conducted before the pandemic, found that 2/3 of small business owners have already spoken with other owners about healthcare costs, and 92% are willing to work together to push for changes to make healthcare more affordable. Nearly half, 49%, said they were very willing to do so. From that same survey, some potential positive news for single-payer activists. And this is a quote: "Increasing healthcare costs is not sustainable for small employers. They want change and are willing to take pragmatic steps. This desire for change does not adhere to party lines. Across the ideological spectrum, small business owners are open to a range of possible solutions. Those favored by small employers require legislative action, primarily at the federal level, to help small employers affordably provide health insurance to their employees. Surprisingly, there was an openness to concepts that might be construed as extreme, like Medicare for all or a single payer system." Other options such as Medicare or Medicaid buy-in also found favor. Though business owners tend to be a conservative group, we did see an unexpected and almost apolitical frame on the issue of healthcare, unquote. Our current system spends 30% of every dollar on administrative costs. Any entrepreneur could tell you that this is no way to operate any venture. Why do we accept this in an industry that is 20% of the entire US economy? This is unsustainable and is not good for business. The Minnesota Health Plan is the only fiscally responsible solution. The Minnesota Health Plan would be the biggest boon to small business development in the history of our state. It would allow spouses holding down corporate or public sector jobs just for health benefits to join the family business. It would mean workers could choose any job that they love in small businesses or startups without having to worry about health insurance. Employers could pay employees more, money that would immediately flow into the local economy. No universal healthcare tax is going to amount to $7 for every employee hour worked. Leveling the playing field would free up capital that small business owners would invest back into their businesses. The Minnesota Health Plan would allow businesses to hire more full-time employees, making it possible for many Minnesotans to escape the drudgery of having to hold down 2 or 3 part-time jobs in order to just pay rent. As an example, our daughter got a job last year at Lund's, which is a great local company that is unionized and provides benefits to full-time workers. But she soon found out that 100% of Lund's cashiers are part-time workers with no chance of getting full-time hours. It costs an average of $1,200 to train a new worker. If healthcare was universal, that cost would incentivize businesses to have 1 full-time worker instead of 2 part-timers. It would reduce a major barrier for would-be entrepreneurs starting a new business. A study by the RAND Corporation found a large and statistically significant increase in business ownership rates during the month when a worker turns 65 and qualifies for Medicare. How absurd is it that people have to wait until they're 65 in order to pursue their dream of entrepreneurship? Would reduce age discrimination. If I have 2 qualified candidates for a position and one is 25 and the other 55, it's hard not to look at the fact that providing healthcare for the 25-year-old is going to cost me $300 or so a month versus $700 to $800 a month for the 55-year-old. In 2021, no one at SmartCent ended up maxing out their deductible. So we paid Health Partners $35,000, and other than them having to send out paperwork, 100% of that was profit for them. So did our rates go down for 2022? Not exactly. Our premiums only went up 4%, but our deductible went up 7%. Paid to a nonprofit company that paid its CEO $3 million a year in 2019. If you were to ask small business owners to name the key to their success, I can guarantee the most common answer would be my great employees. We work in our business next to our staff every day, and we are an important part of what makes our communities great. You'll find 2 groups: the ones who pay healthcare benefits for their staff, but worry about unsustainable year after year increases. This is a major expense that you only have 1 month to plan for after you get your renewal notice. The other group is small business owners who would like to provide health benefits to their staff, but can't increase their prices enough to cover the expense, which, as we've seen, can amount to $5 or more per hour worked. This weighs heavily on both groups, with few options and an increasing divide between small business benefits and those available from corporate jobs. I have lost some of my most talented and committed employees who left not because they didn't love the job, but because they could get more money and better benefits at a large corporation. This is not only bad for small businesses who create the most new jobs, but also bad for the community as we lose more and more small businesses that contribute to our quality of life. All of this creates a unique opportunity in the long and protracted battle for universal healthcare coverage. 98% of businesses in the state of Minnesota are small businesses who together provide 48% of all jobs. With overwhelming support in the small business community for reform, it's time to flip the narrative that businesses oppose single payer plans like the Minnesota Health Plan and frame passage of this legislation as a pro-small business initiative, and make sure that every elected official knows this. The pro-business, pro-employee solution is universal health care, just like the rest of the world figured out many years ago. Our current system is unsustainable any way you look at it. We pay more money for worse outcomes than any country in the world. It's time to build our local economy and support small businesses and their employees by leveling the playing field, removing the burden of employer-based healthcare, and controlling costs while providing healthcare for all. After the last few years struggling through a pandemic, it's pretty clear we need to pass the Minnesota Health Plan now. And I would just conclude by saying, if you own a small business or know of a small business owner struggling with this issue, I'd be happy to talk more. I will put my email in the chat and encourage anyone to contact me directly, and we can get you or anyone you know connected with small business efforts in this area. So thank you very much.
Thank you so much, Kevin. I heard a lot of really strong talking points in this in Kevin's remarks, and he has agreed to share this information with us so we can send it out. Please use this when talking to friends, family, neighbors, coworkers, members of the public who we need to bring along. And when you hear small business, also think farmers, think rural Minnesota, think younger people who are going to face this for their whole lives. So really the arguments are all on our side. We just have to get better at making them. So thanks a lot. I think we may have some questions, and I'm going to let Jen and Judy take care of that.
Sure. First question is, Kevin said that we do not hear much of what he was talking about is not covered in the media. Why is it so hard for this information to be covered in local and national media? I don't know if anyone specifically wants to address this. It's very complex in trying to get the media to take on stories. Does anyone feel, Kevin, do you have any thoughts?
I guess that's the $1 million question. I don't have a great answer, but it is a little frustrating to me when I look at the mass media and there's all these stories that come up. All they would have to do is say, in another example of our broken healthcare system, right? So if you had every media account using that one phrase, it could totally flip the dynamic. Why don't they do that? Well, if any of you watch TV, what's the most prevalent commercials and source of revenue for media companies? Drug companies. It amazes me that you can see all these ads for these rare and seemingly unusual diseases trying to sell us a product that we can't actually go out and even buy. So it seems like they must have a pretty high profit margin. And the media companies don't want to lose that ad revenue from drug companies. And that's just my theory. I don't know.
Yeah, I agree with you. I don't think anyone specifically knows directly what the reasons are, but money makes sense as it affects so many things in our world today. Next question. How do large companies justify the unfairness in the current system? Do you have any thoughts on that, Kevin?
Well, clearly profit. Again, we come back to money. I think, obviously, as all of you know, if you study, if you look at this issue for 15, 20 minutes, you realize that it's the inequity in the system that sort of perpetrates it. I've often wondered why companies like 3M and Target, these big flagship companies in Minnesota, are resistant to reform. And, I've sort of realized that the management structure, they all get super great Cadillac plans. At the same time, they're self-funding their coverage for, the cashiers and stockers in Target stores, to really minimize their expense on that end. So they have a very skewed structure where their management gets the best benefits in the world and their workers get some of the worst. And so why would they want to change that? Why would the decision makers want to equalize things when they're coming out on top? And again, I think it's just greed.
Totally understand that. In the chat, we have Anne has commented regarding our first question, that you are right about the influence of advertising money on mass media outlets. And Dr. Bracke says that we should all be constantly bombarding our media with letters to the editor or suggestions for stories regarding the issue around healthcare and healthcare financing reform. So I think that's an excellent suggestion.
Yeah, I would also throw out too that, a big player at the legislature, whenever this issue comes up, is the Chamber of Commerce. And it's a little ironic because if you go to, small town Minnesota, the chamber does some really great things, right? It provides sort of networking opportunities for small businesses, where they can connect and be part of a local community. I think what's ironic is that I don't think most chamber members in outstate Minnesota realize what positions their state and national lobbyists are taking when they go to these hearings and sit there and say that, healthcare reform is going to kill small businesses. And small business owners are inherently pretty busy, and it's hard to track all these issues, but I do think there's some opportunity there to connect with small town Chamber of Commerce organizations and do some education about what their state and national chamber is advocating for, because I think they'd find a big disconnect with their individual needs.
Thank you. Next question. Kevin, are small business owners approaching the League of Minnesota Cities about healthcare costs? I called the league and one rep said healthcare has not been an issue that's been raised and brought to their attention.
I am actually not familiar with that organization.
Sure. Maybe Dawn, can you put a link to it in the chat and we can look into it if possible? And it looks like Juliana's typing an answer to Dawn about it as well. Next question. The current system gives large companies advantage to the labor market. I definitely think that's true. Do you have any thoughts on that, Kevin? It's more of a comment, but.
Yeah, no, I mean, I think to some extent, I think there's been lots of surveys done that people in general prefer to work in a small company. I think it's pretty obvious why. And so, the large corporations particularly in Minnesota, which make up 1% of the number of businesses but provide half the jobs, that's really the only tool that they have to keep and retain the best employees, is to provide better pay and better benefits, right? Because it's not necessarily a better working environment. It's not necessarily more fulfilling, more satisfying. And so there is this competitive advantage that they have in being able to pay 20% less for one of their major expenses than small business owners do. I mean, I get a little frustrated sometimes with Republicans who are pro-business, but can't see that they're subsidized, that the system is set up to subsidize the largest corporations, right? I mean, that's not a pro-business stance, to allow a whole industry to provide a 20% subsidy to large corporations just because they have a larger pool in their benefit plan.
Sure, we had one comment that I think is another thing that's good to point out. Big companies do have a recruiting advantage with the current dysfunctional healthcare benefit system. And that's unfortunate because small businesses do provide wonderful things for our community. Next comment question. I was employed at the University of M in my 20s at the heart transplant department. What I learned is that all doctors in training were required to do was research only on drug company sponsored issues. The formulary doctors use today in prescribing drugs are based on this restricted research. I don't know if any of our physicians that are on the panel would be willing to discuss that. Either Ken or Mark, or Anne maybe has a comment as well.
Pat, I don't have a good comment on that. What you're suggesting is that the grant money that drug companies give to these academic medical centers may influence what drugs actually get studied. Mark or Ken, if you want to comment, have a better comment than I do.
Mark is typing an answer back.
There is a lot of industry influence on what gets studied, absolutely. On the flip side, there's a lot of public money that goes into researching drugs that we turn around and then get overcharged for. So.
Sure. That was our last question or comment. Anne, do you want to?
Thank you so much. I think we not only have learned a lot, but we have a lot of issues that have been raised this morning. I want to comment on one thing. Insurance policies are a very regressive product. In other words, it costs just as much money for a lower income person to be insured as a higher income person. So higher income persons and big companies are relatively insulated from the cost of health insurance compared to small businesses and lower income persons. Also, these really big companies, as Kevin pointed out, are self-insured. So they pay a fee to insurance companies to manage their employees' insurance benefits. They don't have to buy an individual policy for every employee, as I understand it, correct? They take the risk of, paying for employee health care coverage. So it's hugely uneven. And for people who comment that they don't, they want capitalism to flourish and don't agree with socialism, this is one of the most heavily subsidized and socialized industries on the planet, health insurance and medical products. So, and we're all paying the price for the inflated prices. So anyway, thank you so much, Kevin. Like, as I said, Kevin is willing to share his remarks from this morning, so you can look at it again and pick out some things that you can use in your conversations with people on this issue and with legislators and candidates as well. Shall we go ahead?
Yeah, I think so. If
Thanks
there's
again.
any more, if there's more questions at the end, we can maybe address them then.
I'll look at one more comment. Then we have the issue of the influence of campaign contributions on our elected officials. So, and the influence of the lobbyists in certain industries here in Minnesota, like our medical products industry and the insurance companies. Anyway, let's move on to, thanks so much, Kevin. So much to learn about this and think about. I'm going to do share screen, and we'll go ahead and go to our next item on the agenda, which is a report from Don Pilkinen, who is our, in addition to serving Healthcare for All Minnesota as a board member and secretary treasurer and board liaison with the legislative committee, Don has taken on the challenge of leading the effort and working with our members and interested advocates in their local areas to get city councils and county commissions to pass resolutions in favor of or in support of state-based single-payer financing and ultimately a national health plan, improved and expanded Medicare for all. Don, I want to let you go ahead and present what we have prepared for this morning.
Yeah, thank you, Ann. And thanks, Kevin, very much. The city councils we've been working with, they do see how businesses would be helped with the Minnesota Health Plan because they are also struggling. They and their city governments are struggling with the ever-rising employee health insurance costs, which is really putting a burden on their city budgets that the speakers following me will address. We have a former council member and a current council member who have addressed and have been struggling with the, at their end, with the employee health insurance problem. By now, most of you have heard the good news this winter that the city councils of Duluth, Osseo, and St. Louis Park passed resolutions endorsing the Minnesota Health Plan and Medicare for All Act, which follows the past resolution by the St. Paul Council in August of 2020. These city government endorsements coincide with the January 26th launching of the legislative caucus for the Minnesota Health Plan, followed by caucus leaders speaking at HCAM's February 10th information session. That's when Senator Jennifer McEwen of Duluth emphasized that the caucus will be leaning on HCAM because area legislators need to see local support for the Minnesota Health Plan, and that city councils passing the resolution like Duluth and Osseo is highly effective. Senator McEwen validates the importance of our resolutions work, especially now because a divided state legislature has slowed the progress of the Minnesota Health Plan this session, except for possible information hearings in the House. Therefore, this gives constituents time this election year to focus on working with their city council members and county commissioners to get endorsements to show incumbents and candidates that their city councils and county boards want them to enact the Minnesota Health Plan because their local government budgets and residents can no longer sustain rising health insurance costs. In addition, the resolution calls upon local government officials to lobby their legislators for the Minnesota Health Plan. Looking at the Senate districts in the St. Paul, Duluth, Osseo, and St. Louis Park areas, there are at least 20 legislators to whom constituents can show their city council's endorsements. And advocates are working on resolutions in several other cities, but we need many more advocates. Therefore, the Duluth, Osseo, and St. Louis Park advocates are with us this morning to briefly relate why their city councils passed the resolution to encourage others to become advocates in their cities. So in chronological order are Joel Cypress, who retired from the Duluth City Council after its unanimous vote for the resolution last December 6th. He will be followed by Osseo advocate Dave Garibaldi and the Osseo council member sponsor Juliana Holstrom, who worked with their resolution, and St. Louis Park advocate Hillary Bestie, who worked with Judith Moore on their resolution. And thanks again, advocates, for being with us this morning to share the good news and really the pressing reasons why the city councils endorsed the resolution for the Minnesota Health Plan. So Joel Cypress, would you like to begin?
Thanks, Don, and thanks HCAM for all your work. I'm really proud that one of my last acts before stepping away from my seat on the Duluth City Council was co-sponsoring a city council resolution that passed unanimously that endorses the Minnesota Health Plan and Medicare for All. And I was asked to comment upon why we passed it. And I want to start by stressing the reason we passed it actually is because Jerry Whitty, who is an HCAM advocate in my community, approached one of my city council colleagues, Roz Randorf, and asked her to take this on. And then she reached out to me and I co-sponsored. And this shows just how important the work of HCAM is and how important it is for people to step up and become advocates. So I really want to urge everyone here, if you're a member, please consider becoming an advocate. And if you're an advocate, please think about your local elected officials and reach out to supportive, sympathetic elected officials, because you can really make this happen and it really matters. As Don mentioned, it passed unanimously, not just because so many of us on the council have personal experiences with the horrors of our current healthcare system, but because our current healthcare system is going to bankrupt municipal government all over this state if we do not quickly move towards a single payer system. And that is something that brought all of us together. I've been on the council 8 years and I see the impact of out of control healthcare costs, the stress it puts on our ability to finance city services, and the stress it puts on property taxes. About half the property tax increases I've had to vote for in the 8 years I was on the council was because of rising healthcare costs. And as we know, the property tax is a regressive tax. So the healthcare system is bilking us when we pay our premiums and our co-pays, and then it's bilking us through our property taxes to pay for the inflated costs. So that is why we passed it unanimously. And I'll just end by saying, and it made a difference. One of our local legislators, who in the past has been sympathetic to the Minnesota Health Plan, but not necessarily outspoken for it, came to me shortly after a resolution and thanked us for doing it and said, now's the time to move on the Minnesota Health Plan. Thanks.
Hi, I'm Dave Garibaldi from Osseo, and I'd like to give you another version of doing this advocacy. Every city is different, but I will say this, I am learning that all politics is local. And late in 2020, I received an invitation from the national group Public Citizen to join their monthly Medicare for All resolution strategy sessions. I attended their December Zoom meeting and heard from resolution leaders in cities all around the country and their successes in getting resolutions passed in their cities and counties. It seemed like a good way to achieve more public attention and support for single payer legislation, so I kept attending the meetings in early 2021 and learned about different strategies. One in particular that I thought would be effective for the city of Osseo was to use actual numbers from the city budget to calculate potential savings for the city under a single payer system. By late summer, I received the numbers from City Hall and made those calculations. I knew 3 of the 4 council members and began communicating with them about the reasons for passing a resolution. Juliana Holstrom was particularly interested and became the sponsor of the Osseo resolution. In December of 2021, she attended a meeting of our HCAM resolutions group. And to learn more about the resolutions process, and we also had information by then that Duluth City councilors had passed their resolution. So it was a good confluence of information that came together right then. And Juliana took the ball and ran with it. She contacted city councilors in Duluth that she knew through the League of Minnesota Cities, as well as the fact that she is from that area and had some contacts. And I'm going to let Juliana take it from there and tell you how this came to pass then.
Thanks, Dave. Thanks, Ken. Thanks, everybody. Thank you for inviting me to speak a little bit on this today. As Dave said, he approached me late spring, early summer about this resolution, and I had to get on board and educate myself. In December, I had a personal experience, and it really enlightened me to how broken our system really is, even with insurance, and good insurance at that. So I took the ball, like Dave said, and I ran with it. Dave is a little bit more on the take your time and get everybody on board. And I knew that we could take as much time as we wanted or had or could make. And we weren't going to get everybody on board in Osseo, but I felt confident that we had a quorum and that's what we needed. And I wanted to be the first small city to set an example that it's not just the big cities. So when I saw what Duluth had done and I heard the passion in Joel's speech, I contacted their city council president, Renee Vanette, and she got me in touch with the sponsors, and we worked together, and it was a great opportunity to meet Joel, to learn from Joel, and the great folks in Duluth. Remarkably, they had a unanimous vote, as everybody else has had, but we had a split vote. And it all comes down, in my opinion, to education and networking. And we have to get the message out there because people, we live in a critical world. Somebody's going to find fault before they look for the positive. And we have to offset that finding fault so that we can educate, so we can network, bond together, and keep growing with these resolutions. And to an earlier question, I put my email in the chat, or the question and answer, but I'm meeting with some folks from the League of Minnesota Cities. I'm very active in the League of Minnesota Cities for Osseo. I've served on many of their commissions and committee and policy making commissions. And I'll be meeting with them on the 10th. I thought it was this week, but it's the 10th. And I'm going to address this as let's get on board LMC and let's save for everybody. Let's learn and educate together. And my hopeful outcome is that we can maybe have HCAM represented at the annual League of Minnesota Cities Conference in June in Duluth, Minnesota. So thanks again to Joel for all the help. Thanks to Dave for being patient with me, educating me, and hitting the accelerator with me when I said we're gonna blow this through, and that's what we did. So keep the faith, keep the education going, and keep networking. Thanks, everybody.
Hello, I'm Hillary Vesti, and Judith Moore and I, who are both from St. Louis Park, joined the City Resolutions Subcommittee at its onset last spring. And then on February 22nd of this year, the St. Louis Park City Council unanimously passed the resolution supporting Minnesota Health Plan and Medicare for All. The biggest hurdle that we had to overcome was the resistance to any resolution, as the city council did not think it was good use of staff or their time to consider them. The second hurdle was hesitancy of supporting its implicit rejection of the present insurance run system, because insurance companies employ so many people in our area. After meeting with most of the council members, Margaret Rogg was the most interested in the resolution. She works for a nonprofit in the healthcare realm, so is the most knowledgeable about its weaknesses. She studied the healthcare crisis and decided that she was committed to bringing the resolution forward. Her careful background work and her thoughtful and precise presentation led to a unanimous vote. It would have been very difficult for anyone on the council to vote no. There were three primary focuses of our resolution. It was racial equity, mental health, and the city budget. St. Louis Park's City Vision 3.0 states the commitment to being a leader in racial equity and inclusion in order to create a more just and inclusive community for all. Many of our worst outcomes of our current system reflect racial and economic inequalities. Those were the heart of the resolution. Because of the increased complexity and volume of mental health crises in our community, which demand greater public safety services, the plan's requirement of the prompt provision of mental health services was critically important. Lastly, the cost to the taxpayers of covering employees' health insurance is a significant part of the city's budget, and the savings gained could reallocate funds to other city projects. So these are the elements that made our resolution campaign successful. And it was also very important that Duluth and Osseo, well, St. Louis Park, St. Paul earlier, but Duluth and Osseo is passing their resolutions helped us a lot. So thank you very much.
Great, thanks everyone. Don, did you have any closing remarks on this project?
Yeah, I just want to thank Joel, Juliana, the advocates, Hillary and Dave and Judith, and I can go on and on. We have advocates working in Maplewood. Carla Sand is one of the leaders there. And Carla and I are going to be meeting with the Maplewood mayor later on this month. And she's been kind of holding back the mayor, but Carla is persistent, and it shows that persistence on this resolution work pays off, as Hillary just indicated. And I did see the video audio on the St. Louis Park meeting, and all the council members were really on board. They made positive comments about the need for getting the weight of employee health insurance off the city government's back. And as Joel indicated at our last resolution advocates meeting, he said that at the city council level, the county board level, just like at the Main Street business level, the dollar and cents nonsense of our for-profit health insurance system and changing it with the Minnesota Health Plan removes ideology from the Minnesota Health Plan to make it nonpartisan. So I think that with the growing number of resolutions being passed by city councils throughout the state, and it sounds like Juliana, in her connection with the city's league, will hopefully get statewide networking going. And with Main Street business owners like Kevin and city councils like Osseo and the others that so far have passed the resolution, it's going to be very difficult for the area legislators to ignore the need for the Minnesota Health Plan. And I just really want to applaud the advocates who are really stepping up and doing a great job to really put this in front of the noses of the legislators. It means so much. Thank you.
Well, thanks, Don. I saw one raised hand, and I don't know, Jen or Judy, is that participant allowed to unmute and ask a question? Or would it, Pat, you could put your question in the chat also?
Yeah, it would be best if they put their question into the Q&A section.
Okay. Oh, okay. And then we will go ahead and go to our next agenda item.
And can I interrupt for 1
sure.
second? I'm sorry, everyone. I just wanted to do a little update for Carol's call for donations and ticket purchases for our events in May. And we are almost to her goal of 1,000. We are at 975. So if anyone is on the fence, you know, you can help us reach it. Thank you.
Yay! Thank you, thank you, thank you. This is great. See, we can do it. We can be like the PDA on Sunday afternoon, and we can go forward and make this happen.
Democrats. They're relentless fundraisers.
We don't need to be relentless, but we can use when we have our audience here, because as an army of people, we can do it. So I can't thank you enough. And if one person can give $25 more, we'll be there. Thanks.
I'm with you. I'm going to introduce next Dr. Ken Engelhardt, who's a board member and also a tireless advocate on this issue. And he's going to talk about a subject that he's particularly wanted to present today. One of the objections that you will hear from the opposition when we are pushing for reform is that, well, they couldn't even make it work in Vermont or California. What makes you think it'll work here? And we seriously just heard this at a hearing a couple of weeks ago at the legislature when asking the representative introduced the cost study for a Minnesota Health Plan legislation. So we need to be able to respond to these kind of comments. An elephant never forgets. It can be years ago and you'll hear this come up over and over. So we have to be able to refute this stuff. Ken's going to brief us on some lessons learned from the recent attempt to introduce and pass a single payer bill in California in their assembly. So go ahead, Ken.
Thank you, Ann. Let's see if we can get technology to work here for us. Can you see the PowerPoint?
Yeah.
Okay. So what I'm going to talk about this morning is my opinion about what I've learned about what happened in California for their single payer bill. There's a lot of excitement around it, but on January 31st, it came to a disappointing end because it didn't get brought up for a vote on the assembly floor. So I have four main lessons to share with you about what I learned about this. So I'm going to go ahead and put this on slideshow from beginning. Okay. So why should we be concerned? Why should we care about California? Well, it's because we need to learn the lessons of history. Here in Minnesota, we're trying to advance the Minnesota Health Plan. And if we don't learn from other states on what went wrong or what we can do better, in the words of George Santayana, those who cannot remember the past are condemned to repeat it. Santayana was a writer and a Harvard philosophy professor, and I firmly believe in his statement there. We need to learn from other states as we go forward. So just some facts about California. California has nearly 40 million people. It is the world's 5th largest economy. In 4th, we have Germany, then 5th, California, and behind California is the economy of India. California has about 7 times the population of Minnesota. And if California were an independent country, it would rank 34th in the world population. So California has more people than the entire country of Canada, more people than the entire country of Australia. So with that population in that state, this represents economies of scale and a significant power to negotiate drug prices when you have that many people living in the state. So for California residents, how do they fare and how do they feel? Well, there are 2.7 to 3 million people living in the state of California, ages 0 to 64, who are uninsured. They have no insurance. So this is roughly half the population of the state of Minnesota living in California that has no insurance at all. And in polling done by the California Healthcare Foundation and the University of Chicago's National Opinion Research Center, this polling was done November 20th to January 21st. The biggest worry that Californians have is unanticipated medical bills. So we heard earlier in this program where Kevin Brown from SmartSet, small business owner, stated that small businesses' biggest worry is being able to find affordable health insurance for their employees. Similarly, in the state of California, the main worry among Californians is getting hit with an unanticipated medical bill. Also in that same poll, 83% of Californians reported that it was extremely or very important for the governor and legislature to make healthcare more affordable. And in that poll, 61% of Republicans felt that way. So let's talk about the history of AB 1400, which was the single payer bill in California and what happened to it. Abdul El Sayed, who you probably are familiar with in reading Medicare for All, A Citizen's Guide, wrote in the New Republic on February 10th this year that the California Democratic Party platform explicitly claims to support single-payer health care, an official position of the Democratic Party. So in February of 2021, about a year ago, AB 1400, the single-payer bill, was introduced by Democratic Assemblyman Ash Kalra. This bill was sponsored by the California Nurses Association. And in the California Assembly, there's a Democratic supermajority where there are 56 Democrats out of 80 Assembly seats. But in that Assembly, only 12 authors signed on to AB 1400, only 12 authors in a supermajority. Those 12 authors represent 21% of the Democrats in the Assembly and only 15% of the entire Assembly of 18 persons. Similarly, in the California Senate, only 8 of 31 Democrats were co-authors. So that represents 26% of Democrats and only 20% of the entire Senate were co-authors for this bill. So this was a big hindrance to getting the bill passed. Only 20 co-authors total when you consider 80 seats in the Assembly, 40 seats in the Senate, a total of 120 seats, but only 20 co-authors. So while we had this problem of getting co-authors to sign on to AB 1400, in the background, the California Chamber of Commerce came up with organizing a Protect California Healthcare Coalition of 122 business groups that opposed AB 1400. Those most vehemently opposed were the California Association of Health Plans, the California Hospital Association, the California Medical Association, and the California Agents and Health Insurance Professionals. And Abdul El Sayed went on to write in the New Republic, and these are the groups from whom too many Democrats take donations and political orders. Just one comment about the California Medical Association. You might ask the question, well, why are the doctors opposed to AB 1400? If the California Medical Association is anything like the American Medical Association, it does not represent the majority of doctors in California, just like the AMA does not represent the majority of doctors in our nation. So something else that happened with AB 1400, Governor Newsom, I call this the Newsom fade, because in the 2018 campaign for governor, he said, I'm tired of politicians saying they support single payer, but that it's too soon, too expensive, or someone else's problem. That was in 2018. So in January 2022, this year, when this AB 1400 bill was coming up for a vote, he said, I have not had the opportunity to review that plan, and no one has presented it to me. And he offered not a single word of support for AB 1400. So a very disappointing performance by Governor Newsom for a bill that would have been one of the most monumental and helpful bills to the people of California in state history. So then what happened was AB 1400 actually passed 2 assembly committees. One of these committees was the Health Committee, and the other one was the Appropriations Committee. And what helped get AB 1400 through those 2 committees was a separate funding bill for AB 1400. And this funding bill was HCA 11, Assembly Constitutional Amendment 11, which was a funding bill to raise $163 billion through a series of taxes on businesses and high earning households, those people making more than $149.5 thousand a year, to fund the single payer system. So this was $163 billion in additional taxes. The cost by legislative analysis for a single payer bill in California would run between $314 billion and $391 billion annually. And keep in mind that just like our nation, California already has a significant expenditure on healthcare throughout the state. So they're already spending money on it, but the $163 billion was that needed to cover AB 1400. So here's where the disappointment comes in. On January 31st, Assemblyman Kalra, who is the main author, decided not to put AB 1400 to an assembly vote. And a quote in Cal Matters from February 2nd of this year went on to say, Kalra said on a Zoom call with the disappointed supporters later in the evening, in which he shared that he believed the bill, which needed 41 votes to pass, was short by double digits. And there was the co-author problem. Here's a photo I took of a Progressive Democrats of America Sunday afternoon program, and it shows you the steps that these bills have to go through. So on the top, you see the main bill, which is AB 1400, the single payer bill, and it did clear the Assembly Health Committee, and it also cleared the Assembly Appropriations Committee. And on January 31st, you see that was the day it was supposed to have an Assembly floor vote, but it wasn't brought up for that vote. It still had to go through the Senate committees, Assembly floor concurrence, the governor's desk. So it still had several steps. And the funding source, HCA 11, is below that. It had to go through similar committees. Would be more challenging to pass HCA 11 because it would have to have a 2/3 majority in each of the houses, the Senate and the Assembly. And then also the funding would have to be put up for a vote to the people of California. So what lessons did I learn from reviewing this and trying to find out how we could do things better here? Well, the first lesson is reducing the influence of corporate money. I just want to contrast integrity and corruption. Integrity of a legislator or a governor or anyone in elected office, true integrity is to do what the voters sent that person to do in office. And contrast that with corruption. I want to give you the definition of a bribe. A bribe is money or favor given or promised in order to influence the judgment or the judgment or conduct of a person in a position of trust. So let me read it one more time and think about this. A bribe is money or favor given or promised in order to influence the judgment or conduct of a person in a position of trust. And there's actually a cycle of corruption, unfortunately, that happens in our country. And this seemed to be further sanctioned by the Citizens United ruling, where an unlimited amount of corporate money now can go into campaign donations, which really is a system of bribery. These donations result in legislators, people in office, passing corporate welfare bills. In fact, letting corporations even write the bills for them. And these corporations have this money granted to them. They also gain even more power, which cycles back to more campaign donations, and you have this vicious cycle of corruption generated. So let's take a look at Governor Newsom's most recent campaign for governor and who contributed to that. Well, you can see the usual suspects listed here. The ones that profit from our current system. United Health gave over $130,000. The California Medical Association, over $120,000, and Blue Cross Blue Shield of California, over $98,000. And Assembly Speaker Rendon, let me tell you a little bit about him. When AB 1400 didn't come up for a vote on January 31st, he criticized the lead author of that bill, Calra, saying he should have brought it up for a vote. I would have voted for it, I support it, but he really didn't do anything to generate support amongst the assembly to get that bill passed. But he was easily able to criticize the lead author, Calra. So over the course of Rendon's career, he's received over $33,000 from United Health Group, over $50,000 from California Medical Association, over $32,000 from Blue Cross Blue Shield of California, and over $25,000 from California Association of Hospitals and Health Systems. So in the summary that Dr. El Sayed wrote in the New Republic on February 10th, he said, as the story of the demise of single-payer healthcare in California is written, much ink will be spilled over the fears of tax increases or a one-size-fits-all program run like the Department of Motor Vehicles. These are, after all, the talking points the opponents of single-payer have promulgated. Less attention will have been paid to the way that Democrats' addiction to corporate funding weds them to do the industry's bidding, to betray their own party platform to oppose a policy that would guarantee them health care while saving them billions. The second lesson about AB 1400 is we need to provide clear details on financing. So Melody Gutierrez wrote in the LA Times on January 31st of this year, still Colorado's bill has faced immense odds since it was introduced last February. For nearly a year, AB 1400 failed to gain traction while it lacked details on how it would be financed. And in the meantime, organizations like the California Chamber of Commerce took that weakness and attacked it. They attacked the proposal as a job killer, and a chamber spokesman said that the legislation would ruin quality healthcare delivery and create the largest tax increase in state history. So when we can't provide these details on financing, that leaves us vulnerable to a tax like the California Chamber of Commerce conducted. The third lesson is we need to secure a firm and unwavering commitment from our governor and legislators to pass the Minnesota Health Plan. We can't just simply accept them saying, oh yes, to appease us and get us off their backs. We have to have a secure, unwavering commitment to get this done. So recall the Newsom fade, where he said he was clearly in favor of single payer when he campaigned for governor in 2018. And then January of this year, he said, I don't know anything about AB 1400. Think of Assembly Speaker Renton's inaction. He did nothing really to whip up votes to get AB 1400 passed. And with only 20 co-authors, Dr. Paul Song, the president of Physicians for a National Health Program California and former co-chair of the Campaign for a Healthy California, said, with only 20 co-authors, this bill didn't have a snowball's chance in hell of passage. Lesson 4, we need to inculcate the fact that we have relentless increases in out-of-pocket costs that exceed single-payer tax. We have to keep driving the point home to people that the premiums, the deductibles, the co-pays that you're paying exceed what it would cost for a single-payer tax. We need to show people graphs. We need to show them visuals that the costs that you see over the years for your payments out of pocket into healthcare exceed those of what your wage increase has been and exceed the rate of inflation increase. So Josie Lepe wrote in the San Francisco Chronicle on February 2nd, polls have consistently shown that a majority of California's voters support single payer. But advocates still have trouble convincing people, from employers to state legislators, that while they'll pay more in taxes under a single payer system, they ultimately will save money. And one of the points we need to drive home is that already our taxes are going up to pay for our current system. In 2017, the state of Minnesota passed the Minnesota Premium Security Program, which takes Minnesota taxpayers' dollars and gives it to private corporate insurance companies who claim they need help in keeping premiums affordable while at the same time making record profits. So in 2019, $150 million went into that reinsurance program. And in 2020, $160 million. So not only are premiums, deductibles, co-pays, and other out-of-pocket expenses happening, but now we also have to pay more in taxes to these private corporate health insurers because they claim, despite the fact that they're making record profits, they claim that they can't come up with affordable premiums for people. So that concludes what I have to say about what I learned about AB 1400 and the lessons learned. And I appreciate your attention. And I have to say it was enjoyable to do this research. It was fun. Thanks, Ann.
Thank you, Ken. I'm gonna, as soon as you take your slides down, I'm gonna just do our last few. I do have some announcements, and I have to just ask people, I know we're a little bit over time, if you wouldn't mind staying on just a few more minutes for some important announcements. If you have to go, of course, we understand and really appreciate you attending this morning. Okay, I'll mention this slide and you'll get it with your post-meeting information. We heard the question about why can't we get media attention, and of course we will continue to need to work on that, mainstream and local channels, but we also, there's such a thing as earned media, which is our social media platforms, and we are on several social media platforms. We've posted the sites. We need you to interact with these. We are going to go do some more training on these. We need you to be interacting with as many as you possibly can, like, share, post, etc. And Carolyn Henke has done a lot of work with making interesting posts and informative. Please interact with that so we can get some more some more traffic on those. We're asking you to set up accounts on at least one or two if you don't have any. Feel free to comment to amplify the message, etc. And then I'm just going to talk about a couple of upcoming events. This Thursday is our second Thursday monthly educational offering, and Dr. Jim Hart, who was one of the early proponents of single payer financing in Minnesota and helped put together what was Minnesota Care and what is now the Minnesota Health Plan proposal, is going to talk about the ABCs of the Minnesota Health Plan and give us some easy ways to remember what's in the bill. So looking forward to that. You should have already gotten invitations for that, and you'll get another one this week at least. Going on right now, yesterday, today, and tomorrow, is an amazing conference sponsored by the One Payer States organization. It's a kind of a consortium of states around the country who are working on state-based single payer financing bills. You can still register. It's actually free. You can kind of attend as much or as little as you like. There's a great list of a great lineup of speakers from all over the country. I said it was free. I'm sure they would appreciate a donation. Go on the website called One Payer States and just register for today and tomorrow if you're available. I think today's events start at noon and go all day, so there's plenty of stuff to sign in for. And then coming up, tomorrow is only noon to 3. Coming up in April is the 2022 Medicare for All Strategy Conference sponsored by Healthcare Now. They're one of our important partners in this work, and they've done several annual conferences. This one again will be virtual. They've extended the early bird registration of $35 until March 11th. Speakers include, I don't have the whole program available yet, but include Representative Pramila Jayapal, who is of course the chief author of the Medicare for All Act of 2021, and then Dr. El Sayed, who you've already heard Ken mention, wrote Medicare for All, a Citizen's Guide, really great book that we are encouraging people to read. Also, please read and share our monthly newsletter and check the website. Judy's done a lot of updating. We have a number of new articles posted, thanks in large part to Dave Garibaldi, who has an eagle eye out for good information that we should be posting. Also, please check for legislative updates, and we're expecting a website to be launched by our new Minnesota Health Plan Legislative Caucus soon. And then the Minnesota Health Plan website, which is just dedicated to the Minnesota Health Plan and information, is updated. It's loaded with good stuff, including a really extensive frequently asked questions section. And finally, I want to just point out that Dave caught an article about the new Congressional Budget Office report on economic effects of single payer healthcare systems. It really echoes information that have come out in at least one or two previous studies. It's posted on our website, and I put links to the report. I put a link really at the top of the chat for the meeting today. Even if you don't read the whole report, the summary is useful. And with what you've heard from Kevin today, this recent report, many other educational materials, the question is really not whether or not single payer financing is the answer. The question is what's stopping us. We'll send these out with the slides, just a lot of information on websites and sites for you to go to for more information. Also, our calendar is up to date. You can access events on our calendar, and then other useful websites for partners in this work. This is just a look at the book that we've been, pitching, and along with Senator Marty's book, which is available on his Minnesota Health Plan website. A couple other useful tools for you to talk to friends, family, and track who you're talking to. My challenge, of course, is always, what will you do when you leave this meeting today? We have to educate, organize, legislate. And then I put some information about the, we've been informing people about threats to Medicare. Judy pointed out to me recently that we need to do more education about the challenges of getting healthcare for younger people. So there's that. But I put some information about this new, the direct contracting entities that we've been trying to let people know are really the next iteration of privatizing and monetizing Medicare, has been rebranded and envisioned to something called ACO Reach. They put lots of nice words in it. Accountable care organizations. Let's see.
And you just hit mute. You're on mute.
Oh, and their goal is literally, and this is our government agency responsible for managing Medicare and Medicaid. And somehow they've gotten it, the idea that that means that it's okay to create innovations that will literally privatize Medicare by 2030. Oops, sorry. So I'm giving you the information kind of updated with the latest from February 24th. We still need to push back. They still need to be hearing from us. And with that, I will let Carol give us an update.
Okay, everybody,
Yeah.
drum roll, please. And we want to have a big thank you to Kevin Brown, who became our first business sponsor. For $250, he's going to sponsor our event, and we will do as much as we can to promote SmartSet. He has a great graphic design company that does excellent work. So we want to give a big shout out to Kevin, not only for being a presenter, but becoming our first business sponsor. And there were other people that gave too. So we are at $1,300. We went above our goal. So we want to thank you. Woohoo. But invite your friends and neighbors and colleagues and get them to go to that site or buy them a ticket to come, because we're going to have a lot of fun. We have 10 fish and Smokehouse. Smokehouse is, if anybody's been to Northbound Brewing up on 38th, and then 10 Fish used to be at Bidet Makaska, and now they have a food truck. So those are going to be excellent food trucks, kids, games, and activities by a theater expert with children. And it's going to be a lot of fun and a lot of things to bid on. And the biggest thing is we are going to hear directly from the Canadian nurse and doctor. Well, and just to give an explanation, we are pre-recording it from Rose in case there's any technical difficulties, but we've had it checked out by Greg Blair, who's an expert with technology, and there's a hotspot at Waban, and Greg and Cheryl have hotspots on their computers. So we'll be able to live stream this and interview right at the park. So it'll be a lot of fun, 5:30, Friday, May 20th. Please buy your tickets ahead, and thank you so much. Thank you very much today.
Thank you, Carol. I am just gonna do a quick little wrap up here. One thing else I just wanted to note that Carol didn't mention is I want to thank those of you who purchased a ticket for a Health Justice Ally. We had 5 people purchase tickets for Health Justice Allies. So thank you very much for doing that. It'll be great to be able to have our Health Justice Allies attend our event as well. Wrap up is the recording for this, as well as the presentations and the information presented, will be available during this next week. We will send out an email to everyone who is registered. So please be on the lookout for that. Again, if you guys have any questions ever, feel free to always email us at info@hca-mn.org, and we'll be happy to help you. Thank you for taking time out of your Saturday morning to join us, and we hope that everyone has a great rest of their weekends. Bye-bye.
Before